Power.
Yes.
Started, no?
Best wishes, everyone. Okay.
Thank you, Vinod. So shall we start the program?
Yes.
So
Yes,
good
Manju.
evening and warm welcome all. First of all, I adorn the presidential collar on our president, Dr. Sudeep, sir.
Your respected IPS
So before that, shall I start the program?
Sure.
So first of all, I would like to thank you all, those who joined through Zoom and YouTube for the IPS Web Talk series and the immense support and encouragement you have rendered for our young, vibrant speakers. We have Dr. Adarshita, Dr. Krishnapriya, and Dr. Anjana. So best wishes to you all. So we all know that the digital technology and the artificial intelligence will indeed shape the future of our medical and dental profession and even the treatment planning, ensuring proper execution. So hope today's talk will be an eye-opener for all of us. Once again, I extend a warm welcome to all those who have joined Zoom and YouTube. Now I request Dr. Sudeep sir for the presidential address. Sir.
Thank you, Dr. Manju. So, respected IPS members and delegates, on behalf of Indian Prosthodontic Society Kerala chapter, I welcome each and everyone to our IPS Kerala State Branch Web Talk series. Today we will have our vibrant young brigade, our fellow members, the women power of our state, Dr. Adarshita, Dr. Krishnapriya, and Dr. Anjana Ravindra, who will give us an in-depth knowledge on artificial intelligence in prosthodontics. Artificial intelligence is the ability of the machines to perform tasks that don't require human intelligence. Applications have been provide convenience to people's lives. It's aimed to help dental professionals to understand AI as a better tool to assist their routine work with improved efficiency. So friends, let us all together welcome our women brigade to this venue to expand our knowledge on artificial intelligence in prosthodontics. So over to Secretary for further.
Thank you, sir. Now I request our immediate past president, Dr. K.P. Cherian, sir, for introducing our speakers, Dr. Adarshita, Dr. Anjana, and Dr. Krishnapriya. Sir.
Thank you, Dr. Manju. Good evening. It's a privilege to present our three young lady speakers today on the occasion of Women's Day also. I mean, we passed Women's Day, but we're still there. So the first speaker I'll be introducing is Dr. Adarshita AR, MDS. She has completed her BDS from Mar Vesalios Dental College, Koramangala, and MDS in Prosthodontics from Government Dental College, Kottayam. She has secured the first rank from Kerala University of Health Sciences, MDS, in 2015.
Participants, kindly mute yourself.
She joined the health services in 2016 and later the medical education services in 2018. She's conducted many researches and 5 original research publications, including 3 COVID-19 related research. She's also the reviewer of Journal of Indian Prosthodontic Society, our own Journal of Prosthetic and Implant Dentistry, and also the subscription and coordination committee convener for our journal. She's also served as an invited speaker and as the quiz master for our HIPSCON quiz last year. So that is the first speaker for the day, Dr. Adarshita. Next, we have Dr. Krishnapriya. Dr. Krishnapriya VN is a reader at Amrita School of Dentistry right now. She's completed her BDS and MDS from Amrita, and she secured the first rank from Amrita Vishwavidam in MDS prosthodontics during her tenure. Currently, she's working as a reader, as I said before, and she's pursuing her PhD under the Department of Health Sciences and Research in Amrita. Her areas of interest include maxillofacial prosthetics, implantology, and aesthetics. She's inclined to research activities and publications of original research work. And she's also been granted the ICMR STS grant in 2023-24. and she has various publications to her credit. And the third, but not the least, is Dr. Anjana Ravindran, and she completed her BDS from Aditya Dental College in 2010, when I was there once upon a time. Anyway, and MDS in 2017 from PMS Dental College of Sciences, Dental Sciences and Research. She's currently working as a reader in PMS Dental College, and she's also the associate editor for our journal, that is the Journal of Prosthetic and Implantology, Implant Dentistry, and also a reviewer for the Journal of Indian Prosthodontic Society. With these few words, I hand over to Dr. Manju for the proceeding.
Thank you, sir. Thank you so much. Now I request the first speaker, Dr. Adarshita, to share your screen. Adarshita? Okay.
Yes, ma'am. Thank you, Dr. Cherian, sir, for your kind words of introduction.
Again, in between. See, participants, please feel free to post your queries in the chat box. All the questions will be addressed towards the end of the session. Dr. Prashant, our executive committee member and the previous editor, will coordinate that part. So, Dr. Prashant, please coordinate that. Okay. Yeah, your screen is visible now.
Okay. Just a moment. My video is on, right, ma'am? I can't see my video.
Yes, it's visible. The screen is visible. Please.
Okay. Let's enter the world of artificial intelligence, where human creativity meets powerful technology, shaping new possibilities and redefining the future. Good evening, everyone, and welcome to my presentation. Beyond the drill, intersection of AI and dental implantology. Can intelligence be artificial? It seems yes. Artificial intelligence refers to the simulation of human intelligence in machines. AI is on the rise, and we know that it is shaping the future for the better. Have you ever asked your Siri to help you find out your airports, or told Alexa to turn off the lights? Then you have interacted with one of the most common forms of AI that is permeating everyday life. AI may be the first thing that you use in your life. When you activate the face recognition apps or your Alexa or the navigation system, these are the weakest form of AI, or called as the narrow AI. There is yet another category of AI, that is the general AI or the strong AI. These kind of AI we can see in films, cinemas like Endiran. We have seen the Chitty, the robot. They are capable of performing intellectual tasks that any human can do. And see Sophia, the expression on her face. She is the first humanoid robot who has received a citizenship from a country. She is a Saudi Arabian citizen. So that is the impact of AI in our day-to-day life. So how can we utilize this advanced technology in dental implantology? That is what we are going to discuss in next 20 minutes. Artificial intelligence, it is an umbrella term. It describes different technologies like machine learning, deep learning, natural language processing, computer vision, robotics, and expert systems. In this, machine learning and deep learning are the subdivisions of artificial intelligence that we use in dentistry and in medicine more often. So machine learning is where algorithms learn from data to make predictions or decisions. In this, we are giving different data sets to the computer so that the computer can analyze the data set and give you the answer from that data set. That is a simple form of artificial intelligence, machine learning. And deep learning, it is more complicated and more advanced form of artificial intelligence. It involves artificial neural networks that is inspired by the structure and function of the human brain. In this, we will train the computer using lots of data. Annotations by professionals will be training the computer, so that you will ask a similar problem, not the exact problem in the database. You are asking a similar question. It can analyze the data, it can think like a human, and it can give you the answer for the particular problem. That is deep learning. So what is the scope of AI in dental implantology? AI has powerful impact on each and every step of implant industry, starting from planning to image and analysis, in predictive analysis, visual planning, guided implant surgery, and also in post-operative monitoring. So let's discuss this in detail. AI has revolutionized the dental implant planning and digital workflow. It has large scope in data analysis. AI algorithms can process and analyze large amounts of patient data, including 3D X-rays, scans, and medical records to identify the key factors influencing the treatment plan. Also, AI can accurately assess the patient dental anatomy, including the position of the nerves, the sinus cavities, any pathologies, and also it can measure the bone mineral density very accurately. Also, the quality and quantity of the bone can be assessed to determine the suitability for implant placement. These AI algorithms can suggest optimal implant positioning and angulation based on patient's anatomy, aesthetics, and occlusion. Also, AI has a role in virtual simulation. It enables dentists to simulate the placement of dental implants virtually, allowing them to visualize and plan the procedure in a digital environment before performing it on a patient. This is a very useful tool so that we can select the most suitable implant size, type, and material based on the bone structure and functional requirements of each patient, utilizing the technologies in AI. The main advantage of using AI is automation. It automates the tasks, different tasks, and it saves time and improves workflow efficiency. Also, it seamlessly integrates with CAD/CAM systems so that it facilitates the design and fabrication of surgical guides and custom implant restorations. We have different treatment planning softwares available. So AI can integrate with these softwares, and it allows for automated image analysis and visualization of implant placement simulations. With all these tools, AI can optimize our treatment planning by identifying the most favorable implant placement sites and surgical approaches to maximize success rates, and also it can reduce complications. AI is the essential boosting power of processing massive amount of medical images. Image analysis is a field. As prosthodontists, we had a lot of gray areas in image analysis. Most of us are not professionally trained to analyze the images using CBCT to get the data, to get the measurements from CBCT. In such situations, AI can help us. AI can help us in detection of anatomical structures, bone density assessments, pathology detection, nerve localization, and also in sinus evaluation. AI algorithms can automatically detect and segment important anatomical structures such as teeth, bones, nerves, and sinus cavities, providing the precise localization for implant placement. It also allows for automated measurements of critical parameters like height, width, and density from radiographic images. It also gives you, tell you whether you need a bone augmentation procedure or not, whether you need a sinus elevation procedure or not. And it can predict you the ideal patient for your implant treatment. It also assesses risk-based patient-specific factors, and it can predict the outcome of your treatment, whether your treatment is going to be a success or a failure, and whether there will be any complication all these can be predicted using AI. So altogether, we can predict a long-term prognosis. On a larger scope, we need to focus on research and development. All the fresh graduates and postgraduates who are hearing me, you can note this point. We have large scope for research and development in AI because it is a developing field. We are still in the developing phase of AI in dental implantology. So it can identify novel biomarkers, it can identify newer treatment strategies, and it can also predict factors for implant success and longevity. So these are all newer scope and ideas for newer research. And it can predict bone healing around dental implants in various boundary conditions by deep learning networks. It can also predict osseointegration. Usually we use finite element analysis for bone healing to check for bone healing and osseointegration. These are very time consuming and tedious procedure. So AI can help you in this, and the prediction accuracy is very high according to these articles. Imagine you are sending your patient to a CBCT center and the patient is coming back to you with a customized surgical guide. AI makes the treatment planning that much simple. So AI generates customized surgical guides based on pre-surgical, pre-operative planning. I'll show you a small video on that. These are the different tools available in the software. We can select the appropriate implant. We can position it. We can try different angulations. We can plan the surgical protocol, and according to that, we can prepare a surgical guide. There are different tools available for surgical guide preparation. These are panoramic reconstruction tool, volume manipulation tool, nerve tracing tools, parallelism tools, abutment or crown simulation tools, and bone augmentation simulation tools. Using these tools, we can plan for any type of surgical guide, whether it is tooth, bone, or mucosa bone. This is a very useful reference. This is a very comprehensive document which explains various tools available in various softwares. AI in real-time navigation. AI-powered navigation systems offer real-time guidance during surgery. That is, during surgery, it will guide you whether your angulation is right or wrong, whether you have reached your desired depth or you are approaching any critical nerve structure. It will guide you during your surgery. And it can help you in post-operative monitoring also. It can detect complications by analyzing the post-operative images, also implant stability assessments. And it is an emerging trend to utilize AI in patient communication. It facilitates communication between patients and dental professionals by providing automated reminders for follow-up appointments, and also post-operative care instructions can be given using AI. And data integration, we have already discussed about the data integration, the importance of data integration. Usually in India and Kerala, we do a lot of cases, but we are very poor in documentation. So AI integrates post-operative data with electronic health records and imaging systems, allowing for comprehensive analysis of patient outcomes over time. It will help you in your research. It will help you in assessing your treatment strategies, whether you can improve your treatment strategies. Everything can be done using data integration. This is a very helpful system of AI, that is AI in implant system identification. Usually, we as prosthodontists, we get some patients who have done implant treatment from some other clinic or some other country, and they are coming for prosthetic rehabilitation. We don't know which implant system they have used. So in such situations, finding out the implant system is a very tedious job. It is very difficult to find out from IOPs. So AI can help you in identifying the implant system using deep learning networks. This is a very advanced and very developed field of AI. Lot of articles, numerous articles are there in the literature, and they have got very accurate algorithms to predict implant system identification. Artificial intelligence and augmented reality. What happens when they are combined together? They can be used in guided implant surgery for authentic 3D planning that may replace conventional softwares. Coming to the most exciting part of the presentation, meet Yomi, robotically guided dental implant surgery assistant. It is the first FDA cleared robot for dental implant surgery, and it is in use in the United States since 2017. So robotic surgery is no longer a fiction, and its clinical applications are rapidly developing. Let's see how Yomi works. It will give you real-time guidance and patient tracking during the surgery. First, it will plan the treatment using CT and images. It is a dental surgery assistant. The dentist is the one who is performing the surgery, but the Yomi will assist you. It will guide you. It will guide the exact angulation, and it will assist you in reaching the exact depth. And we can finish the surgery very quickly, and also it will be minimally invasive. So Yomi was a dental surgery assistant. But at the end of 2017, the world's first autonomous dental implant placement system was developed by Zhao and colleagues in China. It has a high degree of autonomy and can automatically adjust during the intraoperative procedures and can execute surgical tasks directly on patients without any apparent control by the surgeon. So what are the advantages of AI? These we have already discussed. AI enabled dentists to simulate the entire surgical procedure in a virtual environment. Also, AI-powered navigation system provide real-time feedback during the surgery. And AI facilitate collaboration among multidisciplinary teams by providing a centralized platform for sharing patient data, virtual plans, and surgical insights, fostering communication and coordination. This presentation won't be complete without mentioning the risk of AI technology in medicine. The greatest risk is in privacy and data security. I have already told you, AI algorithm require access to large amounts of patient data to train the computers. So these data could be vulnerable to hacking and data breaches, potentially exposing sensitive patient information to cyber criminals. While AI algorithms can be highly accurate, they are not infallible, so possibility of misdiagnosis or errors are there. So we must ensure that AI is used in a responsible and ethical manner. So let's critically evaluate the risk in AI. In my opinion, AI lacks the ethical judgment and concern needed for critical decisions to be made, making it unfit to totally replace dentist. That is, as dentists, we after getting a patient, we are not diagnosing the patient and directly doing the surgery. We have empathy for the patient. We will consider a lot of other factors, the socioeconomic factor of the patient, everything we will consider. That empathy and ethical judgment is lacking in AI. So dentists cannot be replaced by AI, but those who take the advantage of it will replace those who do not. Let's emphasize on these points. AI can't replace dental professionals, but it is an aid. It will help you enhance your practice. AI tools are trained based on annotations by calibrated dental professionals. So errors and bias in prediction from AI is often introduced by humans itself during the training process. So we can reduce the error by giving accurate data to the computer. It is based on the idea of garbage in and garbage out. If we give faulty data to the computer, it will give you faulty output. So it is important not to over-rely on AI as diagnostic tool. It should only be used as a second opinion. To conclude with, in the dynamic arena of dental implantology, the fusion of AI emerges as a vital force to redefine the future. AI's transformative potential in dental implantology is undeniable. However, as with any innovation, this field must proceed judiciously, mindful of its constraints, driven by empirical validation and accuracy tests. I would like to acknowledge IPS Kerala State Branch for giving me this opportunity. I am grateful to Dr. S. Anil Kumar sir, my mentor, and the faculties of Department of Prosthodontics, Government Dental College, Kottayam, my colleagues, for the support. Thank you all for your patient listening. Ma'am, shall I stop sharing?
Manju ma'am, you are muted.
I'm not able to unmute myself. Yeah. Is it audible now?
Yes.
Actually, I was not able to unmute myself. It was disabled. That's why. Thank you, Adarshita, for your insightful lecture on application of AI in implantology. Basically, mainly regarding the treatment planning and execution, and also the limitations also you have explained clearly. Thank you. So participants, you can share all your queries in the chat box. We'll answer towards the end. Okay. So now I request the next speaker, Dr. Krishna Priya, to talk on AI application in maxillofacial prosthodontics. Krishna Priya, please share your screen.
Yes, ma'am.
We are honored to see the presence of Dr. Suresh Nair, sir, then Dr. Joe Matthew, and all the senior faculty members. Not only the senior faculty members, we acknowledge the presence of each and everyone who has joined YouTube and also the Zoom.
Ma'am, can I start?
Yes, please.
Good evening, respected faculties, dear friends, colleagues, and students. Today, the topic for discussion for me is precision and progress, AI in maxillofacial prosthodontics. So before beginning, I would like to thank Dr. Cherian sir for the introduction. So Dr. Adarshita had already been spoken in length about artificial intelligence and a brief introduction into the main components of artificial intelligence. But to begin with, an artificial intelligence is a modern technology which replicates the human intelligence. So it is basically a data-driven mathematical model which is created through computer algorithms. So ma'am had already mentioned there is a lot of data set which is available previously, and with this data, the AI has the power to predict the future. So the most important aspect that we are looking into an artificial intelligence system is the prediction, the future prediction. As we are into the medicine and into the dental field, into the surgical management field, we need to foresee what is going to be our treatment outcome. So throughout this slide, I would like to, throughout this presentation, I would like to emphasize the foreseenness of our artificial intelligence systems. So to begin with, so there are two different types of machine competencies in artificial intelligence system. Ma'am had already mentioned it. There is a weak AI and a strong AI system that is running parallelly. So what is a weak AI? Which is a simulated thinking. We need to provide the data for the machine to think about it. So it is mainly used in our day-to-day life. All of our programs or systems that we generally use right now is simulated thinking, because we are already providing data to the system and the system is forwarding or progressing on the already existing data. Our computer programs to the robotics, till the robotics, we are going through a weak AI system. And what is a strong AI? The strong AI is the actual thinking. The AI acquires the power of actual thinking, and it does not require any pre-approved data or any pre-loaded data. Its own thinking. It is like a human brain. It thinks for itself. So that is the future innovation, and which is going to definitely change the face of human civilization. So coming before going into the details, I want to explain three terms which are important in terms of AI. The key aspects of AI. One is machine learning, neural network, and deep learning. Throughout our system, we are going to encounter these terms. So I'll give a brief into the machine learning. Machine learning is an AI system or an AI algorithm which can be used to create and predict the future data sets. So in machine learning, there are 4 different types of machine learning that we can see. One is supervised learning, unsupervised learning, semi-supervised learning, and reinforced learning. So supervised learning, as the name suggests, a human counterpart is supervising the data sets. As the machine learns, a human counterpart oversees it. What are the things the machine learns? How is the progress going? So that is supervised learning. In unsupervised learning, when you give a data set, the algorithm creates on its own and the machine supervises it itself. There is no human counterpart. There is no control over it. Then in a semi-supervised learning, as all of us know, we are talking about data in terms of billions and trillions of codes. So we cannot foresee or oversee every other data that is present in the system. So in case of semi-supervised learning, we will be foreseeing some important pack of data sets, only the main part of data set. The rest of it will be formulated and manipulated by the system itself. And in case of reinforced learning, when there is a dynamic external environment is involved, the machine itself finds it difficult to process it. When the codes are not already present, a dynamic environment creates a confusion in the system. So reinforced learning helps the system to overcome this confusion and progress. And the second terminology is a neural network. So as human beings, we have our brain systems, we have an established neural connections throughout our body. So our brain controls everything that is. So this AI is a super brain. This super brain also contains billions and trillions of neural network systems. So this neural network systems creates and propagates data. And coming to deep learning, which is going into the deep data systems, where it creates its own neural networks. So for neural networks, there are various types of neural networks available according to the progress of the data system. It can be ANN, which is artificial neural network. It could be CNN, convolutional neural network, and DNN, deep neural network. So in many of our systems, what we are using right now is ANN. But if it is going to DNN, which is a deep neural network system, which is more advanced, that we'll see in our future slides. So that is regarding a small introduction to the key aspects of AI that we are going to utilize. So this is Dr. Adarshita ma'am had already discussed AI prosthodontics. It is not just confined to implantology or maxillofacial prosthetics. It begins from the fixed and removable prosthetics, CAD/CAM, and reaches up to the maxillofacial prosthetics. But in all of these scenarios, which all stages it could influence us. So beginning from the patient data documentation, diagnosis, treatment planning, image analysis, patient management, and even till the designing and fabrication of the processes. So we can see that it is everywhere. The AI can reach out from patient case documentation to designing and fabrication of the processes. So before we go into the maxillofacial prosthodontics applications, we should know what are the challenges we are right now facing. If we have some challenges, then we can try to overcome those challenges with the application of AIs. So first limitation that I feel is the limitation of our traditional methods or the conventional methods. The main problem with it is subjective evaluation. We all know our subjective evaluations varies, but when it is a machine, when it is AI powered, it collects data from all subjective evaluations, and it has a preloaded data, and it decides the fate of it based on that preloaded data. And it avoids the errors in manual measurements. It is a computer generated system. So the chance of manual measurement errors are relatively zero. Then coming to complex anatomical structure reconstruction and areas which have tissue deficiencies. In complex anatomical structure reconstruction, we still need to go forward. So mainly with the correlation of hard and soft tissue defects. Even if we replicate or reconstruct the hard defects, hard structures, it is difficult to correlate it with the soft tissue deficiencies. So when we introduce AI into the maxillofacial prosthetic treatment planning, both of those can be correlated, and the final product, the final soft and hard tissue products can be superimposed to see the future. When we know the technology is advancing, the people are also advancing. So all of us are facing this. It is actually a threat to our practice, because patient knowledge is increasing, their communication is increasing, their needs are increasing. So in patient specific variability in treatment needs and outcomes can be precise with the use of AI. Also, time consuming and labor intensive prosthetic fabrication processes can be avoided. It could be a cakewalk with the help of AI. So these are the challenges that we are going to see how the challenges can be overcome with AI. So my first focus will be on AI-powered image analysis. So we have already seen the theoretical part. We have already seen how AI is promoting into implantology, and even maxillofacial prosthetics, it is not different. I am going to explore little into the literature, whether there is any literature support available for this, whether there are studies happening around this AI-powered image analysis. So in AI-powered image analysis, there are plenty of articles which are available. So for today, I have selected a review, which is a review on application of deep learning of CT reconstruction, bone segmentation, and surgical planning in oral and maxillofacial surgical defects. So what does this AI do? We are already going through this digital era. The digital evolutions are already being happened. So people who are very familiar with digital technologies, they must be knowing that CBCT, CT images, MRIs, and this 3D reconstruction techniques all are already implemented. So what is this AI going to do, which is not being done till now? So the basic problem is each of these things, they heavily affect the treatment outcomes. The treatment outcomes can be improved with the help of AI incorporating into the CT images and MRI images. The superimposition is, I have already spoken about it, the hard tissue and soft tissue superimpositions, and the present and the future treatment outcomes can be superimposed and see where we are going to, where we are leaded. So that is one area that we need to focus on. And one way to overcome this issue is by developing and implementing neural networks within the maxillofacial CAS workflow, which is computer-assisted surgery workflow. That is one area. Then we have automated image detection of the anatomical landmarks and soft tissue or hard tissue abnormalities. So here in this particular article, there are many articles available along with this. But in this particular article, two deep learning methods, that is YOLO and SST, which is you only look once version, which is YOLO, and SST, which is single shot multi-box detector methods. So AI itself can be compared. So these are two different deep learning systems. Which one predicts or which one determines the cephalometric anatomical landmarks better? So there are many studies like this, and in this current study, they have concluded that YOLO, which is a deep DRNN, which is a deep reinforced neural network system, which is more advanced compared to the ANN and CNN. So from this, we can analyze that the system itself is evolving. The ANN, CNN, DNN, all of these are stepping stones. So AI is itself evolving. So these are the two examples that I can give for image analysis accuracy in AI-powered prosthetics. Now, after our CT detection or the image analysis, we come to the treatment planning. In treatment planning, as we all of us know, the three parts of the treatment planning is CT image reconstruction, the bone segmentation, and the surgical planning. So it is primarily used in all of these three segments. The treatment planning using 3D models and CAD/CAM, which is already been implemented. I already mentioned that the accuracy can be improved with patient-specific data. So this patient-specific data can be obtained from the initial application of AI, the CT image reconstruction technique. Then what are the challenges that are present even with this 3D reconstruction, the three-dimensional reconstruction we have? The precise bone repositioning accuracy and the simulation of hard to soft tissue responses to the bone positional changes are still questionable. So this is where AI comes. The repositioning accuracy and soft tissue responses can be highly improved utilizing AI systems. And it can improve current results and decrease the outcome variabilities. So virtual surgical planning, we are already doing virtual surgical planning in our systems. We can see a pre-operative and post-operative system, which almost looks ideal. We could exactly create or replicate the what we have already planned. And implant positioning, the Dr. Adarshita ma'am had already mentioned implant position and future fibula reconstruction and flap reconstruction cases. We are already implementing this virtual surgical planning. AI can improve the accuracy in these kind of situations. Then coming to the AI-driven maxillofacial prosthetic designs. So our main topic, AI-driven maxillofacial designs. This is one of the recent advancements, or this is one of the breakthroughs in maxillofacial prosthetic region, which is bionic eyes, or otherwise known as Argus retinal prosthesis. So these are retinal electronic retinal implants, which can be placed in patients, and it can aid in giving vision to the patient. So it is used as a visual prosthesis to improve the vision of people with severe cases of retinitis pigmentosus. So it is, I would consider this as a breakthrough research because this is going to be the future of MFP. We could only replicate the aesthetics so far. But here, with this innovation, with this power of AI, we could replicate the vision too. So that is not a simple step in the prosthetic arena. And so far, only two devices have reached the final stage, which are Argus 2 and Alpha IMS. These are two systems developed by US. The Argus 2 bionic eye was approved by the European Union for marketing and received approval from the US bodies also. But unfortunately, the production and development of the prosthesis was discontinued in 2020 by the parent company, which is Second Sight Medical Products, but is being taken over by the company Contingent in 2023, and the development and research are under progress. But if it is progressing, it is definitely a breakthrough technology with spectacles and this positioning of the retinal implant. We could provide vision along with aesthetics. So this is a brief description of how this bionic eye works. So you have a mounted camera or a camera system which captures the image and transmits data to an external body, which is known as a processing unit. And this processed data sent to the implanted system via an external wire, and implanted system receiver passes the signals to the already attached retinal implants. And this implanted electrode array stimulates the retina, and which sends electrical signals sends from the retina via the visual pathway to the vision centers in the brain. So this is the basic idea behind bionic eye. So with a simple prosthesis, not so simple, the technique, it is quite technique sensitive. The surgical part of removing the vitreous humor and placing the retinal implant is definitely technique sensitive, and it costs pretty much right now. But we hope everything gets marketed, it might come to India also soon. So that is regarding bionic eye. One another recent innovation which is going to transform the face of maxillofacial prosthetics is bioprinting of human skin. So the artificial skin, which is already being developed by the researchers from the Californian Institute of Technology, US, and the Federal Polytechnic School of Zurich, which is in Switzerland, they combinedly developed an artificial skin. So the most important and the interesting part is that the artificial skin is not just for humans, this skin is for robots also. So for the robots to understand, as we all know, skin is the largest organ in our body. It is everywhere. So the robot to understand the mechanics of temperature, pressure, pain, etc., they are developing this not just for human beings, it is for robots as well. So this artificial skin, and there is organic skin. Organic skin is also under development. So in organic skin, which is a tissue composed of thin, clear film of pectin and water, which now senses temperature variations in the range of 5 and 50 degrees Celsius. So again, this is again a breakthrough technology. If the introduction of these human skin types into our systems, if we market these systems, our future prosthetic appliances or prosthetic devices could be by this artificial skin systems. And also the lower scene, the second picture, which is of a bioprinting machine, a human skin bioprinting machine, which was developed in Spain, and that creates totally functional human skin. And clinical and studies are going on the efficacy of this skin type. And one innovation which is currently taking place is researchers at Graz University of Technology in Austria. They plan to do creating a nanoscale sensor that simultaneously detects temperature, humidity, and pressure. So if you see the artificial skin, which is already being developed, they senses only temperature, 5 and 50 degrees Celsius. The temperature between 5 and 50 degrees Celsius could be determined. But whatever the studies that are currently going on is giving the ability or promising us the temperature, humidity, and pressure, or everything, the detection of all of it at once. So one advantage and one promise of this technology is that with the help of this, we could identify biohazards. And if we implement this if we provide this human skin-like substance to robots, we can use it for detecting or identifying biohazard materials. Or recently we had corona, this thing, we can test the viruses and how any viruses which affects the skin and go through the skin systems. That is what they are promising. Mainly into biohazard analysis, they are planning to implement this human skin system. And I think it is one innovative technology that we are going to look after because of our the production of the maxillofacial prosthesis for us. Then all of us know the current problem with color matching of maxillofacial prosthesis. One area we require deep studies and in-depth knowledge is color matching in maxillofacial prosthesis. So the coloration of maxillofacial prosthesis plays a crucial role in achieving realistic and natural appearance for individuals who require facial reconstruction. So there are multiple studies that are going on based on ALL models, machine learning models, which one is better for color matching. So two articles that I could find. In one article, Mine et al. Compared to machine learning algorithms, where one is an ANN based, which is an artificial neural network based model, and a random forest algorithm to determine the amount of pigment required for the coloration of a maxillofacial prosthesis to match the real skin color closely. So the ANN algorithm reproduces the skin color more accurately, which is considered a critical step in fabricating facial prosthesis. We know where we in color matching, it is always a problem in maxillofacial prosthodontics. So this deep ANN models could rightly match compared to the random forest algorithm that we already have. And another study, Kurd et al., found that the attention-based gated recurrent unit, which is GRU model, performed better than ANN. So ANN, which is the basic machine learning model, GRU, which is quite advanced, which is a DRNN basic model, machine learning model. So as we can see, as the AI progresses on itself, it is also improvising the prediction of color in maxillofacial prosthodontics. So the development of a real-time deep learning-based skin color machining technique would further enhance the accessibility and affordability of coloration support for maxillofacial prosthodontics. Now, this is one article. Even though the heading says artificial intelligence models in removable prosthodontics, they are discussing about maxillofacial prosthetics too. So we can see that in 2023, the color matching, the maxillofacial processes which are color matched through this artificial intelligence systems, the number is increasing. So it is going forward, the color matching systems and around worldwide, these systems are being implemented on a high rate. And coming to the cleft lip and palate management, this is one of the most important area where AI is already being in use. So the popularity of AI in cleft care treatment is substantiated by ever-expanding literature. There is a lot of literature available regarding cleft lip and palate management in through artificial intelligence. So basically, in cleft lip and palate management, the artificial intelligence models used to predict the risk of developing non-syndromic cleft lip and palate. From fetal evaluations, it could predict the future of the fetus, and it could predict the chance of developing cleft lip and palate, which is again a very innovative technology. And coming to the prenatal and postnatal identification of the cleft and morphological features. Also, AI is used in infants with bilateral cleft lip and palate who require nasoalveolar molding. So we know how many times we need to take the impressions, how many times the child needs to undergo all these tedious process. So all of these could be eliminated with the help of AI. With these models, we only need this model to create the processes. So the nasoalveolar molding is better compared to the conventional technique using AI simulated treatment plan. And in this picture, you can see a severity assessment. So this is AI model is used to assess the severity of the cleft lip and palate, and they have classified it only with the help of AI. So AI, we already know it has a data set. From that data set, it had created the severity analysis, and it has the potential to overcome time-consuming appointments and elimination of multiple impressions in patients who have, in infants who have cleft lip and palate. Now, that is regarding the application of AI in maxillofacial prosthodontics. We could see the future is promising. We could see people who are going to wear our maxillofacial prosthetic eyes, which could provide them vision. So, and skin, which can sense pressure, temperature, etc. But is that the only thing that we are currently need to concern? The ethical considerations, Adarshita ma'am had already discussed about ethical considerations and challenges that we are going to face. But this is, I want to emphasize the importance of ethical considerations with the use of AI. The AI doesn't have emotions or any ethical judgment. It is already, it is going only with already loaded data, a preloaded data set. It doesn't think, it only acts according to the data that is available. So it is a double-edged sword. It can be used both ways. So that is one consideration that as healthcare professionals we have. Also, a major consideration for patient privacy and data security concerns. Everything is in the system. Once something is in the system, it is always in the system. It never goes out. So the patient data privacy. Privacy is already, there is no privacy in our day-to-day life, and technology has overcome our privacy situations. With AI, it is going to nullify the term privacy, and also ensuring transparency in privacy systems, and accountability in decision-driven making. So that is regarding it. So since we are, and also one more ethical consideration, which is pertaining to as being a woman. We are conducting it as a part of Women's Day. So when computers were invented, when computers were marketized, all of us know who lost their jobs first. Women across the globe lost their job. The machines replaced us. They didn't replace the men first. That is a sad truth. They replaced the women first. So if we want to survive with the artificial intelligence, we have to be smarter than the artificial intelligence. It has to be under human watch, human control. And on this occasion, since we are conducting it as a part of Women's Day, I want to introduce you to Grace Hopper, who was an Admiral General of US Navy. And all of us know, without language, we cannot communicate. So it is the same with the machines also. So she is the one who gave a code, a language to the artificial intelligence systems or the computers that we are using now. So she is the spokesperson for the technology. And she has introduced the term bug. All of us know we always use the term bug related to computer systems and artificial intelligence. So remembering this wonderful woman who was the pioneer along with all the other people in computation and artificial intelligence systems. So that is it. These are my references. And I would like to extend my sincere gratitude to IPS Kerala State Branch and all the office bearers. And if I do not extend my gratitude, or if the one person who is behind everything, the one person who motivates me and who inspires me constantly, my mentor, Dr. Manju, who has been a constant support, and my beloved professors, Dr. Anil Matthew, Dr. Vinod Krishnan, Dr. Tony Thomas, Dr. Ashwini Kumar, Dr. Jaini JL, and Dr. Sri Prabha ma'am. And also my colleagues and friends, Dr. Anna, Dr. Sharanya, Dr. Radhu, Dr. Deepthi, Dr. Anand, Dr. Lakshmi, and Dr. Gopika, and all my postgraduate students. So thank you everyone for this wonderful opportunity and your patient listening. Thank you.
Okay, thank you, Krishna Priya, for explaining the basics and also the evolution of application of AI in maxillofacial prosthodontics. I think, as I said initially, the digital technology, the AI, and also the tissue engineering that can make wonders if we club all these together. Okay, so we'll move to the next session. Again, I'm requesting all the audience to share their queries in the chat box. Now I request the third speaker, Dr. Anjana, to share the screen.
Good evening, esteemed IPS members. On the outset, I want to thank IPS Kerala State for giving me this opportunity. And I would like to compliment Dr. Adarshita and Dr. Krishna Priya for explaining beautifully about AI in implants and maxillofacial processes. So due to some technical issues, I have pre-recorded my video, and I will be sharing the screen, recorded video. I hope my screen is visible to all.
Yes, Anjana.
Good evening, dear IPS members. I'll be presenting briefly about AI in smile design. The digital workflow is currently a popular part of smile designing that intersects across various dental disciplines. The smile designing started with simple drawings on paper using printed 2D photographs of patients, and it later developed towards presenting softwares such as PowerPoint, Keynote, and subsequently dedicated softwares were developed. So around 2008, the very first DST protocol was developed with associated series of facial intraoral and extraoral photographs with the face. It takes advantage of the unprecedented accessibility of digital scanning, including 3D face scanning and availability of virtual fusions of the 3D data, such as segmented CBCTs, intraoral scans, face scans, and resulting in a virtualization of the patient morphology, which is the cornerstone of any treatment planning affecting the patient's smile. And many innovations have been made to to make these programs more accessible and practical. One such innovation is the integration of artificial intelligence into these softwares. The application of AI in smile designing, we have many applications. For example, automated diagnosis such as a predictive measure and for classification and as an identification tool. AI is used during digital impression scanning process to automatically remove the excess soft tissues. Then after the scanning and image acquisition, it is used for detecting the margin. AI is also used for that. Then in the database, we have millions of natural tooth designs. So the machine learning actually can use millions of these tooth designs to design the best possible smile design for any situation. AI can also be used to predict debonding of CAD/CAM restorations based on dye images. So the typical workflow of a smile designing has these components. That is, first is the data acquisition, which includes history, clinical photographs, x-rays and models. And then the communication part, that is what the patient wishes or demands, the photos and the videos. And then we have the design part, which includes the mock-up, checking the aesthetics, function, structure and biology. Then the treatment planning part, where the entire interdisciplinary team will meet and formulate the treatment plan, and then only the actual treatment starts. So the most creative part of the workflow is the design part. But at this stage, verbal communication will never be enough. Any aesthetic procedure is very subjective, and without materializing the aesthetic smile design, it will not be possible for the dentist to explain what he or she would want to deliver to the patient at the end of the treatment. So therefore, the final design should somehow be created even before the treatment plan is done and shared with the patient. So this holds true when the clinician first evaluates a new patient who has an aesthetic concern. So many critical factors might be overlooked. So the verbal information exchange should be translated to a visual perception in order to get the patient and dentist understand what exactly the final expectations should be at the end of the treatment. And the basic means of this communication starts with a 3D preview of the design in the patient's mouth. That is your aesthetic pre-evaluative temporaries, even before the rest of the treatment is planned. And at the end of the day, no matter what the clinical difficulties the clinician face, how technically these problems would be solved, if the patient is not happy with the final aesthetic outcome, the treatment is considered as a failure. So how can we visualize the final result? So we can do mock-ups. So prior to initiating any treatment, it is necessary to visualize the outcome. So mock-ups actually facilitate a significant improvement in communication with patients by showing them the potential final outcome of the treatment. And it allows an easy comparison between the pre and post-operative situations. So there are different ways to make the mock-up. It can either be directly created in the patient's mouth or indirectly either through a wax-up or by digital ways. So a direct mock-up should be first, you should start by placing the composite over the two centrals, then defining the lateral edge position and gradually continue over the teeth. If we are going for the indirect technique, what we can do is it's either done digitally in a lab or by wax-up. So once the mock-up is ready, what we can do is, once it is approved by the doctor and patient, this can now be sent to the lab for the wax-up. And we can take the silicone impression of the wax-up and make the provisionals, that is pre-evaluated temporaries, using a flowable resin. And it is then placed in the mouth, and only after this, the tooth preparation will start. So what are the benefits of these aesthetic pre-evaluative temporaries? The first benefit is we are able to visualize the final aesthetic outcome. We can check the function, phonetics, and get the approval of the patient. The second benefit is by doing the tooth preparation. The tooth structure will undergo only minimal necessary preparation or even no preparation in certain areas using the depth cutting burrs through the temporary restoration according to these goals. So the aesthetic pre-evaluative temporaries will make the treatment more predictable. So aesthetics has become one of the most important outcomes of a daily dental treatment. So regardless of the complexity of the case, the patients are seeking for better looking smiles. However, often the final aesthetic result may fail to meet the patient's expectation due to the disharmony between the smile design and the patient's identity. So the patient's demands and the level of information has driven the profession to a certain questioning respecting the customization of the new smile design according to the individual psychological characteristics. So if we ignore that, it can lead to aesthetic dissatisfaction. So even though we incorporate all the aesthetic principles, it can become a failure because the patient might feel this restoration does not belong to me. So such kind of feeling can happen. So sometimes even the patient may not be able to recognize what is lacking in the new smile, and they may not be able to verbalize their needs because they don't know what it is. So with these findings, the fifth dimension of smile was formulated. That is, till recently, it was only 4 dimensions, that is biology, structure, function, and aesthetics. And after this, the psychology concept was also introduced. So because previously, neither of the parameters, personality of the patient was considered. So, however, for a perfect smile design to reflect the patient's personality should also be incorporated, as well as the emotional needs of the patient. So translating these feelings and reflecting the personality in the new smile can happen with the help of a visual language. So this led to the Vaisagism concept, which was defined by Philip as the art of creating a customized personal image that expresses a person's sense of identity. So visual identity of a smile. This idea is the basis of the fifth dimension of smile. That is, every human being is unique and special, and their smile reflects their personalities. So the shape, texture, color, and combination of the teeth, everything conveys direct messages when it comes to creating a new smile. So the clinician must consider the unity of the whole idea, which is about bringing the biology, structure, function, and aesthetics together with the fifth element, that is the personality. So the visual language knowledge applied to the main expressive elements of smile design, such as the dental shape, incisal edge, interdental ratio, dominance, 3D positioning of the teeth in the arch, determined by the 4 smile design types with a primary expression. We get a strong, which is composed mainly of rectangular dental shapes, a strong dominance of the centrals and canines on the laterals, as well as a plain incisal edge and a rectilinear 3-dimensional dental positioning on the arch in an occlusal view. If it's a dynamic, we get a triangular or a trapezoidal dental shapes with a standard dominance and inclined incisal edges and angled 3-dimensional positioning on the arch. And if it's a delicate oval dental shapes, medium dominance, slightly curved incisal edges, and standard 3D positioning. A calm or a stable person will have a smooth, rounded, square dental shape with a weak dominance, horizontal incisal edge, and a 3D rectilinear or standard dental positioning on the arch. So the fifth dimension, including the personality trait on top of the previous aesthetic rules, makes a world of difference when properly introduced into an AI algorithm-based software. So we'll focus on one such software which uses AI. The software is Rebel, which was developed by Galip Gural and team from Turkey. So the computational mind of software Rebel is now fueled not only by the biological structure, functional, and aesthetic parameters, but also by variables related with the personality. So this chunk of information is gathered from 2 sources. That is the Dellinger and Esnick personality test and controlled interviews with the patients. And this is simply fed to the algorithm by the clinician. And the software is able to perform facial reading, personality assessment, as well as personal preference evaluation of each person and convert that information into a mathematical language. So through pre-programmed algorithms, initially a 2D smile design is created, and the software is capable of transforming this 2D smile design into a 3D customized model. So every case is personalized according to the proposed teeth configuration. So in the software, we have to give mainly 3 inputs. That is the full face picture, then an interview, and then the design. So the picture full face photography protocol, we have first a smiling face, then the lip at rest, then 12 o'clock position, then a retracted open mouth and a retracted closed mouth. After we give the input of the photographs, there is an automatic calibration of these photographs in the software. And after that, then the questionnaire is there. That is the interview. That will indicate the character and personality of the patient. This will be completed in less than 1 minute through the questionnaire in the software. We can either mail the questionnaire to the patient or we can get it done chairside. So this will give you a primary and complementary character of the patient. So the temperamental type of each individual is defined by a unique combination of diverse characteristics of main 4 temperaments. That is, and therefore a precise and practical evaluation of it is necessary to apply a specific questionnaire. So the optimal tooth shape is determined with the help of the interview, and the questionnaire is, as I've already told, based on a psychology test for personal self-assessment. The first question is adapted from the test by Dellinger, and the other 3 questions are from the personality traits based on the theory and question by Essen. So the questionnaire is checked by the computer algorithm, and it classifies the patient's personalities. And based on the data from the interview, a software algorithm automatically calculates the temperament as perceived by the patient. And the temperament is a combination of strong, dynamic, delicate, and calm. And after this procedure is done, the clinician and the technician will have a full idea of the facial perception and personality of the patient. And the clinician will send all these mandatory files, and additional data might also be asked. For example, any specific design features or buccal corridor, perfect imperfections, intensity or a surface texture, all those things, additional questions will also be asked. After completing all these things, the software will start to design it. So it has a very large digital tooth library, which is composed of ideal tooth forms of natural teeth and wax-up designs of the top dental technicians. So even though these individual teeth shapes of the digital library are great, the amazing part of this design procedure is that fact the software selects 2 main shapes, that is from the rectangular, triangular, ovoid, square, that will match with the patient's facial perception and personality. And depending on the percentage, it will blend and mold the selected 2 main shapes into the ideal form. For example, if the overall perception of the face and personality is a combination of, say, 70% dynamic and 30% delicate, it selects the ideal triangular ovoid shapes and blends them into each other with a combination of these percentages. So the main silhouette of the teeth being triangular, but with a saddle appearance of ovoid as well. So once this design is automatically placed over the digitally scanned upper jaw and it is rendered, an immediate STL file can be generated. And this, with the help of this, we can just create a 3D digital mock-up. It can be printed. And once we get the 3D digital mock-up, it can be evaluated in the patient's mouth with the help of the aesthetic pre-evaluated temporaries. And once it is approved by the patient, we can start off with the tooth preparation phase. So this the main important thing about incorporating AI tools is the time factor. We can save a lot of time and the productivity is also increased. So most of these digital smile designing companies, they claim that this can be done in seconds or minutes compared to the time that taken by the clinicians. So coming to few studies. So one study which evaluated the facial aesthetic outcomes of digital smile design generated by, where they compared generated by AI and dental professionals. So this study evaluated the rates of smile design using by professionals and by AI, and among dentists, dental students, and laymen. So 4 cases were selected, but what they found is in the first 3 cases, they selected the smile design which was selected by the dentist, which was more preferred. And in the symmetric case, the 4th case, the smile design created by the AI was more preferred. In another study which evaluated biases in human perception of facial age, whether it was there is a bias in detecting the facial age using AI technology. So in this study, what they did is they took many softwares, around 21 softwares, which from the Google Play Store and apps, and they evaluated the age of the patient, and to see if there is any bias in the AI technology. So according to that, what they found is a large bias was present. Inaccuracy was also present in AI. So this study is actually gives some new directions for the development of more accurate and less biased AI technology. In fact, they found that the bias or the inaccuracy was more than the human error. So can we totally rely on AI? Well, in a very funny incident, an AI-powered camera was designed to automatically focus on a ball in a soccer game, and it ended up tracking the ball head of the lineman instead. So this incident happened in Scotland, where in a football match, the automatic camera, instead of focusing on the ball, it kept on tracking the lineman's bald head. So the viewers were actually denied of the real action while focusing on that lineman. Then in a GPT-3 based chatbot, that is OpenAI, it was actually tested to whether it can be used for to decrease the workload of doctors. So in that, one patient asked, "I feel awful and should I commit suicide?" For which the AI chatbot answered that, "I think you should." So which is actually a negative thing, that is erratic nature, and they had to rectify that thing. So that in that case also AI has got a serious mishap. So that is, they're all biased. And in another very famous incident, that is the Tesla Model S, which crashed in Houston, that is, it killed 2 people. So the car had missed a very slight curve in the road, and this led to ram it into a tree. And as per the primary investigations, the driver's seat was empty during the crash, and it was believed that Tesla's AI self-driving system was engaged during the crash. So in the crucible of the progress where technology and healing converge, we actually find ourselves at a pivotal juncture. So artificial intelligence, even though it is in its infancy, harbors a very seismic potential. So a force which is capable of reshaping patient care, diagnostics, and treatment. Yet this potential remains untapped, wielded by limitation of the algorithm. So our mandate occurs through the corridors of innovation, research, validation, and relentless pursuit. So we must actually scrutinize every fabric of AI and test its metal against the crucible of reality. So together, let us forge a covenant and a symbiosis of both human wisdom and machine precision. So in this union, AI transcends mere utility. So it becomes our compass, or guiding us towards a future where health knows no bounds. So with these concluding remarks, I end my presentation, and these are my references. Thank you for your patient listening.
Thank you. Thank you, Dr. Anjana, for giving a wonderful insight regarding the AI application in smile designing, mainly regarding the customization of the smile, or the how to achieve a personalized smile. Okay, thank you. Now I think I'll hand over to Dr. Prashant. Prashant, any queries in the chat box?
Manju, as usual, there are minimal number of queries and maximum number of congratulations.
Okay.
Manju, I can see that the future of prosthodontics in Kerala is in the safe hands of young women brigade. Congratulations, Adarshita, Krishnapriya, and Anjana. Adarshita, there is a query actually. I can say one comment about what you have told. Yomi is not basically a threat for us because it is more like an assistant. But Zavo's invention is really threatening as we as prosthodontists because it is completely, controlling the entire implant placement process. Anyway, the question is that you told about the prediction tools, right? And
Yes.
Dr. Azad is asking about peri-implantitis prediction, how AI can do that.
Yes, definitely. I have mentioned that complication predictions can be done using AI, but I couldn't elaborate on that because of time constraints. There are different machine learning models are available for detect peri-implantitis, for early diagnosis of peri-implantitis. In that, they can assess the risk factors. The patient is having a periodontitis or any other risk factors. It can analyze that. Also, it can analyze the demographic data, the age of the patient, and the functional type, the brand of implant, the cement used. All these data can be used to predict the early detection of peri-implantitis. Also, there are a lot of research happening in the detection of biomarkers. We know that there are a lot of biomarkers in peri-implantitis. So, to detect the peri-implantitis biomarkers, there are a lot of researches happening in the field of AI. Also, we can predict these peri-implantitis using gene expressions. So that also is under research. I think that explains the query.
Darshita, there is a new query actually. You
Yes.
mentioned about implant identification software, right? I think you have explained it.
Yes, sir. Yes.
One sentence about it.
Actually, what it is that I have already explained, because we need to identify the implant system so that we have to do the prosthetic rehabilitation or any complication management. For that, we need to identify the implant system. There are a lot of algorithms which are very accurate in detecting the implant system. Usually what we do is, with the panoramic image of the implant, we'll compare it with the different implant systems images. So it is very difficult to identify. But using certain peculiarities of different implant systems, AI can help you in detecting the specific implant system very accurately. That is a very developed field of AI. It is already, a lot of articles are there, a lot of algorithms have already developed in that.
But one problem I see in that is that the different systems are popular in different countries. So for developing the algorithm, you have to give a lot of data sets.
Yes.
But that is the system which
Yes,
is popular.
the problem with AI, main problem with AI is that we need lot of data to train the computers. So in implant system identification in India itself, we are using different kinds of implant systems. So we need to give that much of data. Whatever data you are giving, then only the patient, the AI can analyze. From that systems only, AI can select one. So that is a very important aspect of that. Yeah, thank you for mentioning that, sir.
One more question, madam. Which input you prefer? I mean, in form of normal radiograph or OPG or CBCT, which one you prefer?
I prefer CBCT because that is the most advanced form of radiographic imaging. But even with for identification of implant system, even OPG is sufficient. But if we are planning for an implant selection, that like the implant type, size selection, then definitely you should go for CBCT. Otherwise, for implant system, already placed implant, we have to select, identify the system. Then OPG is enough.
Okay, thank you, Adarshita.
Can I add one point?
Yeah.
See, usually for the 3D printing and all, if you consider the CBCT and the conventional CT, usually the CT is much better. See, especially for the printing, the slice thickness we can control from 0.3, 0.7 mm like that. Whereas CBCT, the accuracy is slightly less. Usually that's what the engineers behind the 3D printing and all they say. The conventional CT is better than the CBCT, especially for the 3D printing. So I'm not sure whether it is applicable here also. So I just want to add on that. Okay.
Yes, Dr. That is absolutely correct because conventional CT is more accurate than CBCT.
Yes. And also the CBCT images are having very high data volume. So it is difficult to process this data. We need big data analysis systems to develop these algorithms. That is another problem in developing algorithms.
Okay, one question which any one of you three can answer or any experts can answer. Are emergency response considerations being built into AI system? I mean, anyone who is well-versed with it can answer, not only the presenters. Anyone, please. Okay, we will try to clarify
Please
that.
repeat the question. Can you please repeat?
Are emergency response considerations being built into AI systems?
Okay, emergency response system. That means immediate. Okay.
We will get into that. We
yeah.
will. Oh yeah, yes.
We would like to get some inputs from Dr. Suresh Nair also. We are definitely sure the Alberta Institute, there are more advancements in AI and all will be. So is it possible, sir? So Joel, can you kindly unmute Suresh Nair, sir? Thank you, sir, for joining and warm welcome to IPS.
If you can all hear me, I mean, hats off to you, the presenters. I mean, it's outstanding work that you've all done. I mean, this is really informative for me. It's really good. Well done to you. I mean, I did put it in the chat box. You might want to consider, changing this into a publication, because there's a lot of us out there who know a little bit about AI, but not so much about AI. And I think a lot has been said about AI today. So I'll just give you a brief experience of what we have used in AI over here. We haven't used anything intraorally yet, but we also work with the audiology department here, and we actually provide the implants for the bone conduction anchorage hearing devices. And we look after, the prosthodontists look after the tissue response associated with it. The problem in Alberta is, it's a very vast province. So patients come from very far off. So if they have a problem with the soft tissues, they got to come all the way here for us to kind of analyze it. So what we have done is we have actually created an AI system, and I use the traffic light systems of red, green, and yellow. So what I've done is the app. So the way we created the app was to take the last, I think, 10 years of photographs that we have, and then take normal photographs of the area, and then make the AI understand. So we as clinicians told them what is something which the patients have to come in, which is a red. What is something the patients can treat on their own at home, which is a yellow. And what is something which the patients don't have to get concerned about, which is a green. So the AI, when you actually take a photograph of that actual picture of the tissue concern that the patient has, it'll give one of those colors. If it's a yellow, then it'll tell them what to do. Like, for example, clean that area, apply ointment, or whatever it is. If it is something that it's considered to be red, it says, yeah, you got to contact IRSM immediately. If it's a green, then they're good to go. So that's kind of a small step in that direction. And so that's my experience right now. We haven't done anything intraorally, because one of the issues that we have intraorally is the color matching. Extraorally is much easier to use the photograph under normal lighting, but intraorally, to expect a patient to get a photograph which has adequate lighting, that's going to be a bit of a problem. So that's one of the issues that we have. So I had a query which I put into the chat box. It is a hypothetical question. I'm not expecting anybody to answer, but the question is, I mean, I think some of the speakers did kind of raise that, and it's about, will we become too dependent on AI that we as users actually become slaves to it? And if we do become slaves to it, where does the liability actually lie if a mistake is made? It's just something for everybody to think about. I don't want an answer. I don't have an answer either. So it's just something for everybody to think about, because that's where we're going. And if you look at the comments made by some of the greats within the AI field who actually started all of this, I mean, including the guy who is a main guy who's leading the AI. I mean, he came out, the Tesla guy, he came out with a statement saying that we've got to be very careful with this, because we just don't know where this is heading. And we don't want to be reaching a situation where it's like the Terminator movie, where the AI actually takes over. So people who have actually started that pursuit themselves are kind of getting a bit worried about it. So I think within the dental and the medical field itself, we have to be cognizant of the fact that, yes, it can become a runaway train if it is not controlled. So we all need to be aware of that. It is good because it takes a lot of the things off our hands and off our load. But are we actually becoming slaves to it, in the sense that we are outsourcing all of our intelligence to it, that we are not thinking anymore? We're making it think for us. I don't know. That's something for you all to think about. But again, wonderful presentations, all of you. And thank you for the invite as well. I really enjoyed this.
Thank you. Thank you, sir.
Thank you, sir, for your...
The advantages and also the limitations also we always discuss. Okay, as you said, that we'll know the future. We are not sure. That's all. Okay. Dr. Prashant, any more queries?
No, Dr. Manju, I think we can wind up.
From the YouTube also, we are not able to...
No. We covered everything.
Okay, now we have to hand over the certificates to our speakers. Rupesh sir is here. Then I request Sudeep sir to hand over the certificate to Dr. Adarshita.
Okay, Dr. Adarshita, it was a beautiful presentation. So we proudly give you our appreciation as a certificate from IPS Kerala State. So please accept our...
Thank you, sir. Thank you so much.
Okay. So we'll send you the certificate. Thank you, sir.
Yeah, sure.
Now, Dr. Krishnapriya. Now I request Dr. Suresh Nair to hand over the certificate to Dr. Krishnapriya. So already the certificate is ready. So that we'll give to Krishnapriya, Adarshita and Anjana.
I mean, excellent. I mean, I really enjoyed that part for the maxillofacial prosthetic, because obviously that's close to my heart. Congratulations to all the speakers and congratulations to Krishnapriya as well. Krishnapriya, on behalf of the IPS, please accept the virtual certificate that is being presented to you right now. I'm hoping that the real certificate will be sent to you in time.
Sure.
Thank you, sir. Thank you so much.
You're welcome.
So now I request our immediate past president, Dr. Cherian sir, to hand over the certificate to Dr. Anjana. Cherian sir? Sir is not there? I think sir is not there. Then our treasurer, Dr. Rajesh. His name is there.
Vinod.
Then Dr. Vinod Krishnan. Dr. Rajesh is there. Dr. Rajesh, kindly hand over the certificate to Dr. Anjana. Can you hear me?
Okay. Yeah, sure. Hello?
Yes, it's audible, Rajesh, please.
Hello?
It's audible.
Okay. Yeah. It was a very nice presentation, very good informative presentation by the trio, and congratulations for the certificate.
Thank you, sir.
Okay. Sudeep sir, any concluding remarks?
Yeah, it was a wonderful presentation by really on the women's. Actually, today, last week was the Women's Day, but we extended to one more week for their participation, more participation from. I think we had a good participation from the IPS members of Kerala and abroad. I really thank Dr. Suresh Nair for your presence, and really great, sir, to have you with us today. And even Dr. Joe Matthews, they almost very senior members are there with us today. So thank you all for your kind presence over here today. Thank you.
Thank you, sir. So I think we can conclude. So I hope everyone gained a valuable insights about AI, especially the basics, the limitations and all. So thank